what I'll be talking today, this is probably the most I'll talk about healthcare is right now, but hopefully the links will become clear as I'm talking through my slides. The model that I've been applying to the world of professional engineering is very much like the model that ethicists applied to the world of healthcare, or at least that's how I interpret what I'm doing. So I work with engineering students, I work with engineers, I work with ethicists, I work with policymakers, but I'm constantly trying to bridge the gap between those different worlds. So I sometimes describe the work that I do as translation. And the work that bioethicists, I suppose, did in turning this kind of philosophical concerns into practical tools and concepts that are used in healthcare, things like informed consent, like figuring out what that means, working with healthcare practitioners to figure out how to put that into practice, what kind of tools do you need, very much what I'm trying to do in the world of engineering. That's the basic snapshot, and I'll be doing this work here at the University of Ottawa now, and at the lab, the Canadian Robotics and Artificial Intelligence Ethical Design Lab that I have here. So, I was asked to give the bias, the kind of intro to bias, but given that I have 15 minutes, the intro will be a 3-line kind of set of things that I want to point out about bias. I'm assuming most of you understand on some basic concept what bias is. You've heard this idea, garbage in, garbage out, biases in the data, things like that. So I want to point out, look, data sets can be biased. They can be biased, like this is where we find bias. They can be biased by being not representative of population, for example. Practices and institutions can also be biased, though, right? And this doesn't speak directly to data sets, but it speaks indirectly to data sets. So for example, you could have a bias in the division of household labor, right? So that we would historically see. And this can, like these social practices that we have around, like in society, can in turn find their way into biasing data sets, biasing the practices around collecting data, curating data, pointing to interesting issues in the data, even being able to identify interesting issues in the data that have nothing to do specifically with the data, but with the practices and norms around and kind of circulating around society that may or may not alert us to particular biases that we find to be important. So those are two different, I think, types of biases or places that we can find bias. And it's important to point out just quickly that not all biases are bad, right? Some biases are designed to compensate for other biases that we have. So for example, the way that we sort out income tax is a type of bias that's meant to disproportionately benefit certain people over others. This is a bias that's meant to correct for certain things and distribute things, wealth in society the right way. It's linked to issues of justice. And that's really what I'll say about bias. So what I'll be talking about today will link to bias. I'll mention it in a slide coming up, but that's just to give you a sense of how I think about bias, and I'll be focused much more on the practices and institutions that can lead to biases, not specifically in the data itself. So garbage in equals garbage out. It's only part of the story. I think it's very important for us to understand that, especially because working with engineers and computer scientists, when I see the practices that they have that can lead to biases being introduced into the models or the different technologies or artifacts that they're designing, it very often has little to do with what's in the data necessarily. The fix is in the social practices around that data. So that's what I'll be talking about. Now, I'll start with this. This is where I get into a kind of a story. I noticed one day, maybe 2 years ago, I was at a meeting. This was at Stanford. A bunch of computer science AI students were having kind of a mix and mingle with us one day, a bunch of ethicists. And, I started getting asked this question over and over. Do you have data? Do you have data? Do you know of any good data sets? Where's the data? And I started to realize that, within an academic institutions and these circles of practice, there's a real focus on getting this data and not much of a worry about what the data has to represent or what it has to do with. The way that problems are constructed at least in the academic context, and this turns into professional practice when you're out in the world, the level of abstraction away from the people or the things that the data is represented is sometimes extreme. Now, I'm painting a bit of a caricature here, right? I'm exaggerating a bit to make a point. But it's almost as if, this is the caricature. It's as if whatever the representations are fade into the background and don't matter. You can do your machine learning, you can build your models without much of an understanding of what's going on. And this is to be expected. So this is very much what we understand as kind of what Thomas Kuhn talked about as kind of puzzle solving, right? So when you're working within a community of practice, the contributions that you make are sort of like solving little pieces of problems. You're not questioning the larger picture of how you go about coming to those problems, identifying what's important, and you never really question the larger assumptions that are built into the community of practice. You're sort of, you're focused on making contributions and showing that you know how to do what people are asking you to do. And you can maintain that level of abstraction in your work. Okay, so I call that kind of situation data agnosticism. This is something I'm playing around with. But it can lead to bias in the way that it blinds us to the people represented by the data, the institutions in which the data is collected, and the social practices that surround all of that stuff, and the model building, okay? So the question then is what leads to this kind of data agnosticism, right? If we want to get past this and start getting people to think more about where the bias comes from, in that respect at least, we have to ask this question, what leads to that kind of data agnosticism? And this is kind of the basic picture that I paint, okay? So if you do a lot of interdisciplinary work, you realize, and in healthcare, this everybody in healthcare should understand this because it's one of the most interdisciplinary environments that you can work in. So many different professions coming in with their ways of thinking about their practice, right? What's important to them? What do they value? And so you'll see a lot of this kind of thing. I use the engineer and ethicist because I'm focused on changing engineering practice right now. But each group of professionals has their own way of doing things. They have very discipline-specific values and practices associated with those ways of doing things, and that means that they care about certain things in a professional context, and they don't care about other things, and this is how they're socialized. This is socialization. So there's a recent history in healthcare of interdisciplinary practice and interdisciplinary education as a means of overcoming this. So again, I'm just trying to apply some of this to engineering. But this creates a problem, right? It creates a problem when you have groups of people that are talking about the other person's work. So in the context of ethics, you have ethicists saying, listen, it could be sociologists, whoever, saying, look, I'm seeing these problems with the things that you're doing. And then you have maybe the engineers on the other side saying, oh yeah, well, I understand what you're talking about generally, but I don't know exactly how to connect that to my day-to-day practice, right? Like I don't have whatever it is that that when I go to work every day, I'm motivated and inclined to incorporate your worries or concerns into my daily practice. And that's a problem. So what I try to do to overcome this is really focus on building what's called interactional expertise. And it's a way, it's basically like bringing these groups of people together in a kind of semi-structured way, much like you'll see clinical ethicists doing lunch and learn sessions with neurosurgeons or whoever to sort of like talk about what neuroethicists are interested this week or this month, what was in the latest journal, and kind of reflect on how it might impact practice, right? Similar kind of thing with engineering, which is not typical in engineering. Ooh, I have to rush through. I have 5 minutes left. This is my problem. Okay, so I'm trying to build this common language around between ethicists and engineers. And that involves common languages, common concepts, frameworks, and methodologies. So what I'll do is, and I've been running these workshops where we're building this framework, mostly with car companies. I deal with a lot of autonomous vehicle work. But it works, the idea is that it would work within any kind of application context. But here we're talking about healthcare. It's the same kind of thing in healthcare, right? Talking to engineers who are designing applications or models for healthcare. What we've developed is this kind of design framework. We call it design for human values. We kind of like the term, kind of don't like it. But it's a series of steps that you can walk people through very structured ways. Engineers like structure, they like processes. So we're trying to take what ethicists do is kind of very open-ended, very, lots of questions, very few answers, and turn it into something that has maybe fewer open-ended questions, starts having some structure to it. One of the things we do is we focus, we focus engineers on like what we would think of as a multi-stakeholder analysis, right? So this is, again, trying to bring the people back into the data or back into the practice. Like, who is it that is impacted by your work, by your technology? What do they care about? We run through this, this multi-step process where we get them to build a tool, use this tool that we're calling a value map. I'll show you some examples. But the idea is that you start reframing design problems away from just thinking of kind of like math and numbers and framing the design problem in terms of people, values, and the kind of value tensions that come up between those different stakeholders. And the idea is that those will bring the ethical issues through into the work and help engineers see how their work connects to people and value tensions. And this is all just code for ethics, but ethics, we don't use that term a lot. It has very particular connotations, and it tends to stop conversations rather than start them in many contexts. So we use this value map and get people to generate value maps to think about their technology in a different way. And this initially is usually very foreign to engineers. They don't do this kind of thinking on a day-to-day basis. So this is just a snapshot of some of the early prototypes of these value maps that I get my students to do in the grad course that I run here. You can see they group people, they draw lines. I just ask them, try to do a visual representation of all of this to try to understand where the values are, where the tensions come in. Just more examples. So they start thinking through tensions, like why would certain stakeholders or their values come into tension with other stakeholders. This really brings them to a point where they can start thinking about the ethics. Just another snapshot. So just different types of visualizing the ethical landscape that they're working within to start. And again, these are all computer science and engineering students. So I'll run through a few of the tools that we use. So this is another tool that I get my students to think about. And again, these are the things that we use to build this common language and practice between these two worlds. So, I wrote a paper with a colleague of mine, Meg Jones, at Georgetown, and we were thinking a lot about the use of metaphors as policy devices. So how could you do policy thinking by using metaphors? Like we use metaphors a lot in technology to describe things. So one of the other things I do with my students is in these workshops is get people to think about technologies as if they were like trading cards, right? Like these gaming cards or hockey cards or whatever you want to think about. And so then they sketch things like what I have on the right there. Like they'll use a metaphor like, oh, this autonomous vehicle is a guardian and it has certain characteristics. And then I ask them to design these cards. Like what kind of things would be important to think about in the context of a guardian? Yeah, thanks. I'll try to rush through. This is another one that, this isn't mine. This I just became aware of a couple of weeks ago, actually. This is coming out of Harvard. This is a tool that they're developing to characterize data sets by using almost like nutrition labels. So they call it data nutrition labels for data sets. And the idea is just like you would have something with calories and fats and carbohydrates, all that kind of stuff, on a piece of food, you could label a data set with a nutrition label to get people to think about, like, what are the limitations of that data? What am I feeding into my model that I've created? And is it healthy or not? Okay. This is just another worksheet that I get people to use to think through the whole design process and elicit the ethics. Again, tools. These tools are important because they're what engineers need in order to get the work done, right? Like, you can't just go into a room of engineers and say, think open-ended about problems. You have to give them something concrete. You have to close the problems. You have to make it more manageable. I mean, engineering is a history of tool making, right? Standardization. So you have to make ethics palatable in a way that, that speaks to their practice. So that's a lot of the research that I do. And so the idea is that this design for human values is an ethics capacity building framework. It's a set of tools, concepts, and whatnot that we can use to bring the people back into the data and get engineers thinking a little more deeply about the values and ethics that are associated with those data sets and with their practices.
Thank you very much. Moving us from what Mazeroff has called solutionism to social context, j'ai le grand honneur de présenter la professeure Catherine Régis. Elle est professeure et titulaire de la chaire de recherche du Canada sur la culture collaborative en droit et politique de la santé de l'Université de Montréal. Elle est aussi chercheure au Centre de recherche en droit public, récipiendaire de plusieurs prix, bourses et subventions, notamment du programme de recherche, chaire de recherche du Canada, mais sans plus tarder, compte tenu du temps. Her talk is titled, Can the Law Guard Against Discrimination in Digital Medicine? Professor Régis.
Alors, merci beaucoup pour cette introduction. Avant de commencer le clock, don't start it just yet. Je voulais juste remercier infiniment Florian et Colleen de m'avoir invité. C'est des personnes que j'apprécie énormément sur le plan intellectuel, mais aussi personnel. Et c'est aussi des gens qui nous font dire que les humains ne devront jamais être remplacés par les machines. Alors, merci grandement de m'avoir invité. So I was asked to talk about this topic, so I didn't decide on the question. It was an interesting challenge. It's probably not in line with the usual work that I do on AI, but it was an interesting challenge, so I decided to take it. And upfront, I can say that the answer to this question is very simple, is yes and no, right? Typical lawyer answer. I will also present with my postdoctoral fellow, Cécile Petitgan, so she'll talk a bit later on. So what I'm going to do today is just talk about, of course, discrimination in digital... Oh, yes. Thank you, Cécile. Can you do it? Discrimination in digital medicine. And first, I'm going to start with what are the challenges and talk a little bit about the pervasive risk of discrimination, and then move on to the limits of current legal tools. The second part of my talk will be about what could be our response to these challenges, and then I'm going to talk about something new that I'm working on with other colleagues called the Equity by Design Normative Strategy. This is something that we'll propose, and then move to some concrete proposition based on such a strategy. So what are the challenges? This is an interesting sentence. There's the quote that was mentioned in an international summit on patient partnership that I recently was part of, I think it was 2 weeks ago. Information, knowledge, and wisdom are different things. We need to move towards wisdom and with digital innovation, not just the first two. I think it's very relevant to what we are talking about today. And by the way, I just also want to mention that patients have a lot of things to say about digital innovation and artificial intelligence, and I think we should really make sure that they are part of the conversation, but because they move towards in ways that we don't always think as experts. So I wish that we include them more in the discussion. Okay, so about the pervasive risk of discrimination. Why is discrimination an issue in digital medicine? I think this question is important because when I work with people, the developers in artificial intelligence, they often ask me this question, or they just mention this point, is why are you so harsh on the medicine, on the machine? Because, you know, humans activities tainted by unwanted and unconscious bias. So the discrimination might be towards the machine. So the simple answer to this question could be, well, discrimination is discrimination, and we should always track it. But I think there is more layers to this question that we can explore. And one is that it could be an amplification of discrimination with artificial intelligence. It could be double, triple discrimination, the discrimination that comes from the developers, and then the discrimination that will come from the physicians and other people involved in development of AI. So it could be additional discrimination, extra layers. Also, once it's ingrained in the artificial intelligence, it's become part of the healthcare system, it could be very large-scale discrimination opportunities in the system. So we need to be aware of that. Also, AI can leave patients behind. We talked a lot about this starting from yesterday. So we have example with AR dermatology that are sometimes unable to adequately pinpoint dark skin patients in their program. So the main point actually of this presentation is there are many points of entry for discrimination to kind of cripple in artificial intelligence in our healthcare system, and we should really be aware of that. And it could start as early as in the choice of algorithms that we develop. Do we only choose algorithms that will favor dominant groups? And people will decide to use AI tools. Patients who will use it, physicians who will use it, healthcare institutions, compared to others who will not use it. There are so many opportunities for discrimination, and I think we need to be really focused on this capacity of AI to not only discriminate with the algorithm in itself, but starting as early as the choices we make when we develop algorithms. So we need to keep this very broad perspective on discrimination. And this is a point that is important to this presentation. Also, another issue, challenge with discrimination and bias in AI in healthcare is they can be difficult to detect. So there are compounding factors that sustain this point. First, we talked about this, so I'm going to skip very briefly, but the data available could be a challenge, a lack of medical professionals from marginalized communities, inadequate information about those communities, socioeconomic barriers to participating in research or in data production, unpredictability, so we cannot, sometimes the biases are not ingrained in the algorithm, but they develop by themselves afterwards. So all these compounding factors make it sometimes difficult to very pinpoint discrimination issues. And we also saw recently in the news, I don't know if you were aware of that sometimes it could be difficult to denunciate as well biases that we come across once the algorithm is developed and really implemented in the practice, and economic consideration become very important. So the limits of current legal tool, another part of my talk. So law and discrimination. This is, of course, not new. Law has been very aware of discrimination issues. There are many different legal tools that tackle this challenge. To name a few, but there are many more. There's the Canadian Charter, Quebec Charter, Tort Law, Commission des droits de la personne et des droits de la jeunesse, which is an institution you can go when you feel that your rights have been infringed, especially regarding discrimination issues. Labor laws, right to access care. We should all have right to access care, especially in Quebec, on an even foot. So that's another point of entry. Canadian human rights, and so on. So once I was asked to explore this issue from a legal perspective, I thought it could be interesting to see whether AI would trigger new issues about discrimination, will need new tools. But in fact, the legal frameworks are pretty solid, and I think it will apply to AI the same way they apply to other issues, as long as you have discriminatory grounds that are mentioned in the legal framework, such as sexual orientation, civil status, color, sex, gender, and all these motives. So upfront, you could say, the law applies, it shouldn't be an issue. For instance, we have in Quebec this charter pretty specifically mentioned that we should be aware of discrimination, and it applies to private and public actors. So really it should cover all issues about AI that will trigger discriminatory problems. And knowing that, actors should take measures to avoid discrimination when they develop their technology, including in the data that they use. So this could be a kind of an ex-ante effect, right? Knowing that the charter will apply or other legal tools, developers should be aware of discrimination and try to develop a technology that is attuned to these concerns. And also, when you talk to lawyers or big firms that are kind of counseling people who develop the technology, they really clearly mention that. So there's kind of an effect that can help us to avoid discrimination to a certain extent. But then I said, okay, the legal framework is there, it's fine. But then I kind of pushed further on that reflection, and I decided, I came to this point where it becomes clear to me that the activation of such legal tools could be problematic in AI. So they're there, they're useful, but it could be problematic when we were to activate them. First of all, there's a difficult burden for citizens to kind of prove there's been discrimination. We talked about this yesterday, just talking about opacity and creativity, the fact that they develop logics by themselves. So all these points make it especially difficult for citizens to prove their case. There's also the lack of AI expertise of some legal actors. We touched on this point yesterday as well. So it becomes difficult to kind of receive this problem and kind of figure it out what's going on and understand the technology and where the biases can come from. So this would be a challenge for sure. Also, courts are mostly reactive institutions, so they will intervene when a particular controversy allows them to intervene. So it's not the best institution to kind of regulate on a day-to-day basis or influence on a day-to-day basis actors who will use the AI technology. And also, I think these legal tools have a weak capacity to underscore discrimination or equality issues during the design of development phases, which is the point that I made earlier, like which tool are we going to develop? Are we including people who are usually excluded from the healthcare system? So legal tools are pretty weak to make sure that we move toward that direction. Okay, so knowing that, I think we should move towards a more preventive and a comprehensive normative approach, which is the second part of my talk. So what could be our response to these challenges? So discrimination is a fact, inclusion is a behavior that we are responsible for, and I think we should really keep that in the center of a reflection about AI. So the proposition that I make is that we should move towards an equity by design normative strategy, and this is food for thought, I think, for policymakers. So I'm going to explore kind of a normative strategy, an overarching norm that should guide the policymakers as long as we move along the way. Sorry about that. And also, the equity by design normative strategy is really about embracing this quote that I put at the beginning is action without vision is a hobby, vision without action is a dream, and action and vision can change the world. So I really try to integrate the vision with the action with this proposition. So with equity by design, equity becomes a core standard, so it's not just an afterthought. It should be as important as thinking about performance, accuracy, and all these buzzwords that we use when we talk about AI. We should put equity up there, along them. So equity becomes a standard through which AI in health system is continuously planned and assessed at all levels of policy making and local care delivery. It's based on a vision of equity where all people should reach their full health potential and should not be disadvantaged from attaining it because of their race, ethnicity, gender, age, social class, language, and so on. And also we should take care about other considerations such as socially determined circumstances. For instance, what it means, this vision of equity, is access to quality education to understand basic medical information, and to adopt healthier behaviors is as important as just equipping physicians to improve their diagnosis. There are three pillars to this equity by design norm. First of one is equity-oriented design. So we have to make sure that AI systems should be designed to attenuate or combat inequalities. The second pillar is inclusive development. All groups, in particular minorities or vulnerable groups, should have the opportunity to shape AI systems and promote their legitimate interest. The third one is equitable dissemination. So AI benefits should be shared broadly and fairly within health systems. And then I'm going to move to concrete proposition based on that normative framework.
So what would be concretely this strategy? We start with the first pillar, which is about developing standards. We know there are many standards that are being developed, but we would like to focus these standards on the core principle of equity. And what would it mean for AI designers? Speaking of industry or university domains, it will be building data set reflecting the diversity of population, because it's quite easy to find data on most represented populations, but when we talk about vulnerable people, invisible minorities, this is really a challenge for the industry. It would mean also technically calibrating and testing models in diverse environments. So we are talking about rural health centers, not only urban ones with lots of technology and resources. We're talking about multicultural settings. So this ability for models not only to be functionable in the most in centers where a lot of resources, but thinking about testing these models to be efficient in the places where there are really a lack of money and resources. We also proposing concretely that when an industry is trying to develop and deploy a system in a public environment, public health system, that we have to show and to present clearly what would be the objective of this technology. So what the problem which has been identified, what the problem that is going to be addressed by the technology, this is going to give more meaning to the technology in our public health systems. So another really interesting proposition coming from the NHS Code of Conduct on AI is to not force, but to give incentives to industry and to AI developers to communicate the limitation of the system they are trying to implement, to deploy in our public health system or private ones, and also to communicate some failures they have identified in their data sets, for example, if they are not representative. So all these standards could be represented as requirements for a certification, an AI equity-oriented certification. We could think that industry developers that will meet these requirements could be evaluated not only at the start of development and implementation of health system, but also all throughout the life cycle of these systems.
Okay, very rapidly because our time is up. The second pillar is inclusive development. And we should provide space for diversity of people to participate, voice their concern, and inject feedback in AI design, development, and deployment. There are many options we could explore there. There are just kind of few propositions. First, we should involve patient and marginalized groups in defining priority issues for AI development. And this is not just like a nice principle. There are concrete examples that we are already starting to implement that we should build on. So this exists. Good opportunities to explore. Also, we should, and this is something that came up with the Montreal Declaration on Artificial Intelligence, the need to create perhaps a big data ombudsperson who would receive complaints and would make it very easy for people from different backgrounds, different region and so on to kind of communicate their concerns about the use of AI, and then it could intervene and make sure that we improve the process. We should also seek patients and health professionals' feedback in order to evaluate and improve AI based on experience. And here we should not only evaluate AI in healthcare, in our healthcare system, based on clinical and managerial criteria such as performance and so on, but also include such criteria as stress, trust, experience at work, and so on, to make sure that we have this complete vision of what could be a concern for people. And I will skip on the, although I really like it, on the last point. So at the end of the day, we kind of try to formalize feedback and voice process in health care system.
I'll be quick for the third pillar, but the main idea is to develop incentives which can be public, in order to develop and support initiatives aimed for the fair diffusion of AI knowledge, resources, and benefits. So apart from favoring the development of open source AI frameworks, but also open repositories for data to be shared among researchers, we would like to emphasize initiatives such as the one which is in development and be implemented at the Academic Health Center of the University of Montreal. If you can look for that, it's École d'Intelligence Artificielle en Santé. It's aimed to form today's and future health professionals to the use and deployment of AI. It's really interesting. It's one initiative that should be popularized and reproduced, I think, across jurisdictions.
Okay, that's it. Sorry, yeah.
Thank you, and thank you all for mentioning the designers, because and exposing the man, and it often is a man behind the curtain, as it's not, artificial intelligence is not a naturally occurring phenomenon we tend to forget. Let us use the time we have left for a few questions. Please step up to the microphone and, as is customary, identify yourself quickly if you have any questions. We won't have time for as many as expected because this is fascinating material. So one and two.
Thank you. Merci beaucoup. I wanted to ask a little bit about, because I'm really interested in the equity by design and incorporating ethics into the actual design of the AI systems. But one of the things that I think sometimes I worry about as a limitation is that for certain kinds of problems, increasing the representation within a data set is not in it of itself sufficient to providing a more equitable outcome within different populations. And one of the things that I worry about is that if we have certain standards where we say this AI was designed equitably or equitable by design, that can in some ways blind the interpreter to potential problematic bias that can still exist within that system. So I was wondering a little bit about, I think particularly with regard to, I think you said critical self-reflection on the limitations. So I was wondering if you could talk a little bit about how you might kind of navigate that desire to incorporate ethics within the system itself, but also remaining cognizant and humble to the fact that there might still be limitations that were not fully addressed.
Yeah, that's a very interesting question, and it was at the heart of our reflection. So this proposition that we make is really based on this idea that we should have an ongoing evaluation of equity at all times. So not just at the beginning or at the end or in the middle. We should be careful about the design process, then we should be careful about the development and the implementation, and keep thinking about, is this equitable? What's happening? We have opportunity for voices to be included in the process with a large diversity of voices to say, well, stop, we realize that this could be equitable, base of discrimination and so on. And we went very rapid on our proposition, so I'm sorry about that, but there's very good example, good solutions that we could use to make sure that what you're concerned about doesn't happen. It will not be perfect, but it will help to have this broad vision of, let's not resolve this issue at the beginning and forget about it later on. We should always keep that in mind, and this is the proposition that we make, actually.
Yeah, just to jump in and echo, I think, mostly what you said is that in the work we do, it's, we focus on, in this multi-stakeholder approach of thinking about things like how do the policymakers, what role do the policymakers have to play in the development and implementation of an AI system, right? So in questions like this where you have limitations and the engineers, computer scientists maybe recognize that there are limitations or that there are certain ways that this tool, this AI tool can and can't be used effectively along lines of equity or fairness or justice or anything, even just the basic health outcomes that maybe they're trying to promote. It's important to have conversations about putting in place policies that will alert not just the tool designers, but the tool users, the public, other policymakers who are relevant to the limitations of those tools. And it's very important in terms of fostering trust within the system as well. So a lot of, what I think about anyway is like how these all link to trust and issues of trust. So I think there's room for improvement on getting people who are building these things to reflect on the limitations and make those things, those limitations more publicly accessible and understood, yeah.
Sooner or later it will. Yeah, Michael Wolfson again, U of O. Either a naive or persnickety, a couple of questions here. And it's sort of around when is differentiation discrimination? Predictive analytics is a hot area in artificial intelligence. There's work, for example, going on algorithms to identify women at higher risk of breast cancer based on their genetic profile. Is it affirmative action or discrimination when we say that higher risk women should have more frequent mammograms? Or what if you aren't considered high risk and you want more mammograms anyway? That would be one example. The other one that comes to mind is with rare diseases. By nature, they're rare, so it would be very difficult to have a data set that was truly representative or had a good enough sample size for those with those problems. So how do those kinds of examples fit into the framework that you were just describing? It's clear that sexual orientation or ethnicity, those are bad things about which to differentiate. But what about these other things?
I mean, I guess on your very last point, I would say maybe they're not the wrong things to differentiate on, as long as you're differentiating for the right reasons and to accomplish the right type of goal within the larger system, right? So if an AI system is able to somehow identify issues and empower a certain group that wasn't empowered before in a way that improves the overall level of justness or fairness and equity in society, maybe that is the right kind of discrimination. So this gets to my point that I made at the beginning of the presentation, is that when you're having a conversation about bias, it's sometimes the case that bias isn't a bad thing, right? We tend to think of it as a bad thing, but it can often be a thing that we design into a system to offset other more problematic biases. These biases come into tension with one another. So, yeah.
Well, since we stand between you and lunch, if there are no further questions, merci à nos panélistes pour ces présentations dynamiques et importantes. Désolée pour ma voix, merci de votre